Coronavirus has reached a global scale. At the time of this video, 87,137 cases have been confirmed across the globe. In the US, 62 cases have been confirmed, and we just had our first death this weekend. This widespread disease has caused the public to go into a near hysteria over the global pandemic. 2,873 deaths worldwide. The flu has killed more Americans last year alone. It's still too soon and not enough cases to understand its fatality rate of just 2%. That is the chances of you dying from getting the virus. The concern is still there though, for elderly and people with lung problems due to the way the virus attacks. The coronavirus is a respiratory SARS virus that attacks the body in similar ways that a flu would, creating symptoms like high fever, cough, headache, body aches, inflammation, and in an attempt to kill the virus. SARS virus can be transferred through the air by a cough from an infected host that then passes on to a human through either the mouth, eyes, or skin. Once inside the host, the invading virus penetrates the host's body cells and uses its RNA to hijack the cell and creates its own food and other viruses that will then burst open the cell, thus spreading the pathogens. Once the immune system is alarmed, it raises the body temperature, conserves energy, and effectively killing itself by killing the virus, creating these symptoms. To learn more about the coronavirus and how it affects the body, click on these information below and in the description. In this video, I will be talking about the public health perspective, how a new virus outbreak came to be, how the government and organizations contain and eradicate viruses, and ways you, the individual, can protect yourself against the epidemic. Good day, my people. It's the King, Aaron D. Wiggins, and today I want to talk to you about the coronavirus as a public health issue. If you're new to the channel, this is People's Public Health, where we talk about all things public health. And if you love our content, please subscribe and turn on your notifications. If you learned something new, tell us in the comments below, as our community would love to inform you on all things public health. Today's topic, the coronavirus as a public health issue. One of the things that many people ask me is, how did this epidemic start? Why did it break out? The coronavirus wasn't native to human beings, yet the lack of regulation, poor protective procedures, and inhumane conditions allowed the virus to mutate to be effective against humans. The coronavirus got this way due to unregulated black markets in China. These places aren't regulated by the public health entities or government organizations, like we have the Food and Drug Administration in the US. They don't have health ratings or any authority that closes down shop that can't keep themselves clean and healthy guidelines for the shops serving to the customers. Owners of these shops would cage, kill, and prepare livestock in the same area. This blood, feces, and fluids creating a perfect incubation chamber for the coronavirus to mature and get stronger. These animals were treated inhumanely, and as sick exotic animals were held together in cages to only be murdered. This has led to the China's rapid response to quarantine and exterminate the virus through any means necessary. To protect the public, isolation and quarantine are methods used to prevent exposure to the people who have or who may have the contagious disease. Isolation prevents the spread of diseases from people who already have it, while quarantine restricts the movement of people who are exposed to the disease to see if they have it. For example, a cruise ship traveling from China with confirmed cases are isolated to exterminate the virus. And for the quarantine in China, major sections of the city have been quarantined off to see if the people have it. Although in secrecy and obscurity, China has done many things to prevent the spread of the virus. It's built quarantine hospitals in days to test and help people affected with the virus, closed off high volume areas, suspended all travel in and out, and boarded up citizens in their homes in highly affected areas. Although these methods haven't been successful in eradicating the virus, efforts in vaccination, analysis, and treatment all play a part in eradicating the coronavirus. Quarantine movies like Contagion, World War Z, and Outbreak all have similar themes of mass hysteria due to the speed of the epidemic, the inability of the government being upright about information, and the failure to execute the plans of eradicating the virus. In the US, there is a plan with the CDC. The Division of Global Migration and Quarantine are qualified to contain the virus. Moreover, the Public Health Service Act of 1944 allows the government to relinquish some of your rights in order to protect the greater good of the people. Sadly, the CDC has been defunded, and its heads of these divisions have been removed without being replaced. But you get who you vote for in America. Vice President Mike Pence is in charge of handling the coronavirus outbreak, whose qualifications and experience with public health outbreaks aren't great, to say the least. His administration in Indiana caused the greatest outbreak of HIV virus in his term. But nevertheless, there are still some things you can do to prevent the spread of the virus or prevent you yourself from getting it. Using personal protective equipment and techniques, you too can protect yourself from diseases and viruses. Washing your hands thoroughly and often with alcohol hand sanitizer can kill a lot of germs, but not touching commonly used surfaces is even better. There is no proof that masks will prevent you from getting the virus, especially if you aren't wearing it or removing it correctly. However, when taking care of someone who is sick, it is imperative you use masks and gloves to protect yourself. On an end note, it is important not to demonize or stereotype people who have the disease. Just because it originated in China doesn't mean all Asians have coronavirus. This type of thinking leads to wrongful quarantine practices, like the quarantine of the entire neighborhood of China of San Francisco for the bubonic plague in the 1900s. Fear and racism removed the rights of American citizens in fear of death from the plague, from people who never had it. However, educating yourself on the coronavirus is the first step to evading the disease. If you want to learn more about the coronavirus, head to the World Health Organization's page right below for answers and live updates on the virus. If you want to learn proper protective equipment techniques, head to the CDC's website to learn more about proper hand washing techniques. Till next time, I'll be with the people. Will you?